morning, classroom. How are you? We are here to engage your mind, your body, and your spirit in this classroom, in case you didn't know. I know, that's kind of a mouthful, but you know what? It is what it is. Unless somebody comes up with a better idea, let me know. Right now, this classroom really focuses more on the mind and the spirit as opposed to the body. I feel DIY focuses on the body, but right now we're getting so deep into the mind, right? And now this is more the body. So I don't even know, because we're talking about pharmaceuticals and the effect on the body. So maybe I should have switched these topics. But this is how it works in the classroom. You're just getting filled with knowledge. Just worry about that. Don't worry so much. And you can worry a little bit about the titles. But if you want to worry about a title, worry about this one. Day 129 in the classroom. Look at that. All fancified too. I got this looking so nice. So yeah, day 129. Focus on that. Focus on that. If you don't want to focus on that, I gotta get my glasses because I can't see all those numbers. Then focus on, this is day 10 of our pharmaceuticals that we're talking about, right? It really is a mind thing. Let me get my glasses. That's a body thing. How'd you get all those twilight zones to speak to me? Those are the things I don't get. Those are the things I really don't get. How'd you get twilight zones to speak directly to me? Because some of those I know, I remember. So whatevs. Anyway, for your sake, I hope it was for the good. But I have a feeling something different was going on. Let's look at those numbers, because I love those numbers on this slide. It's the only one that we get to play with the numbers. Pharmaceuticals, day 10. Performance enhancing drugs, day 3. Engaging a healthy mind, body, spirit, day 52 of 129 days in the classroom. 52 of it has been focused on engaging a healthy mind, body, spirit. That is combining critical thinking, critical thinking along with our spiritual classroom. So we endeavor on all those topics in all of our classrooms. But right now, I'm trying to engage you. I don't know, maybe this is more. No, never mind. I don't know. I think I got them mixed up. Theoretically speaking. Not really. I didn't get them mixed up, but theoretically speaking, probably so. All good information. Let's go. I mean, we were reading books, so this works. I don't know why I'm rehashing it right now in front of you. Okay. But I do have some fantastic slides I was working diligently on since this morning. Now notice, since 5:45 this morning, 6 o'clock, 5:45 actually. So these I leave the old dates on so that you can look back when we were talking about the definition of performance enhancing substances on February 27th. And then there are performance enhancing substances. Again, we presented those on February 27th. And then we've gone through the anabolic steroids, the stimulants, and actually I think we presented these on the 28th and 29th. I didn't change those dates from when I had put these together. Oh, that's because these are all of these. That's why. Never mind. Listen to the music that's going on in your head. Oh, there we go. Remember, here's the thing. I mean, oh my goodness gracious, I did not bring you any information on the pill. So we're doing a little backtracking here on the pill. All right. And in fact, I don't know if we are going to get to our stimulants, but I didn't want to go and say the pill again. You know what I'm saying? On our thing. So we're doing the pill. Title doesn't say that, Dr. Feravich, and I'm thinking you're misleading. Yeah, I know what you're saying. If I only had good help. Okay, so let's take a look at the purpose. The purpose is to prevent pregnancy, as we know. Maybe you didn't know, maybe you did know. It's 99% effective when used as prescribed. And this is interesting language, right? You want to pay attention to that, when used as prescribed, because, for example, medication that can be addicted is not addicted when used as prescribed. Okay, sounds like some delicate language there, doesn't it? Oh no, it's not addictive at all when used as prescribed, but it might get me a little antsy to take more. You know what I'm saying? Oh, I just bit my tongue. You know what I'm saying? What does it do? What does the pill do? It stops ovulation by manipulating follicle stimulating hormones. Those are FSH hormones, follicle stimulating hormones. The follicle releases the egg, right? And luteinizing hormones, LH, which are factors that get you ready for pregnancy. Okay. Estradiol, there's for an E to represent that, and progesterone, a P to represent that. By lowering estrogen or estradiol and progesterone, the body is tricked into thinking it is pregnant and does not release an egg. So, lowering estradiol and progesterone, which are hormones in the body, means I'm not going to then release hormones such as FSH and LH because I don't need them to release. That gets us ready for pregnancy or menstruation, right? Well, if my estradiol and my progesterone are lowered, I don't have to get my body ready for menstruation because I think lowered estradiol and progesterone says I am pregnant. All right? Which is interesting about the problem with higher levels of progesterone, when lowering the levels of progesterone actually is a better thing. If you recall, we had talked about that in our Bookless classroom when we were talking about Margaret Sanger and Catherine McCormick, and getting and the doctors not caring about people getting ill from the pill, and women getting ill and all these kinds of conditions because they had too high of a dose of progesterone, which actually it's supposed to be lowered according to this. So see what you find out when you begin to do some investigation, but also learn how to piece things together. Why? Because you're looking at things honestly, right? All right, if there's a discrepancy between what this says and this says, then you better look into it. You know, we use, which we're going to get to, Ritalin and Adderall, which has similar effects as caffeine does, but they're using different medications in Adderall and Ritalin for the same kind of thing, right? So this sounds to me like a test is what it sounds like, right? It sounds like a test to me, a research test. Wonder what the effects of this are going to be. And they don't really care. It's just like, I wonder what the effects of hope is going to be. But I don't really care if it increases your hope at all. Not me personally, of course, but I'm talking about, as I said, psychiatrists and psychologists who can tell you and have knowledge, psychologists, all about hope, right? But have not improved your will to live or hope in any measure whatsoever. So what's up with that, right? What's up with that? Okay. All right. So it also, though, which most people don't know, as I did not know, and probably is valuable information, it also thickens the cervical mucus to create a barrier between sperm and uterus. Okay. Well, that might be good information as far as lovemaking goes. Does that harbor more bacteria and disease? That would be good information for my partner to know, wouldn't it? Maybe he'll put a condom on, right? All right. It also thins the lining of your uterus, so a fertilized egg cannot be supported by the so you could basically get pregnant, but even if you got pregnant on the pill, you would lose that baby through a thin uterus lining. Now, this is anecdotal, but it's my personal experience that I had a hard time holding my second son. I felt like he was always falling out. Well, that to me says thin uterus lining. I was on the pill for a number of years, but not as long as most people are on them. I would have to say, I think I was on it for 6 years, something like that. About 6 years. Yeah. So, got any questions about that? You can ask. Put them in the comments below. I'll answer them. Okay. And then the side effects are increased blood pressure and blood clots. So pulmonary thrombosis is a blood clot in the lung. You might get leg cramps, which are caused by blood clots, small or large, in your legs, for example. So those are other side effects, but they both have to do with what would appear to be a thickening of your blood. And that also can be caused, thickening of your blood can be caused by more platelets in your blood, which makes sense. High blood pressure, more platelets in your blood. Platelets are in your blood that help repair wounds. All right. So that might be there might be increased platelets. And so thickening of the blood, increased blood pressure. So increased blood pressure is the push of the blood through. Well, if your blood is thickening, then you would probably have, or clotting easier, right? So it's thicker, not thinner. And then all of these blood thinners that are necessary. So this is one example of those side effects, but who knows, that same kind of thickening of the blood side effect, we're going to try and get through them as we do this. So, but we used to have trials for this, and the trials were not supposed to be conducted on the entire population. I don't know. I mean, if they had within the first months of release, I don't know, what was it? 200,000 women who were on it within the first year. Well, maybe that was their research that they did on it. So do you understand what I'm saying, right? I don't know that they did appropriate research with a group of participants that were randomly chosen from the population, right? And did that study according to appropriate scientific methods. You can see that the push for getting this out was tremendous. So getting around ethics is not difficult, number one. There aren't a lot of consequences to getting around ethics, number two, especially during this time of research. And again, number three, there was such a push by women to get this, to have more control over their reproductive systems, right? Okay, so we can understand the side effects of the pill. Let's take a look at a couple other things that I have here for us to look at. Okay, well, this is where I left off, but we're not going to start there. Actually, I'm going to pull it up before I pull it up for you, so we don't start there. Which is on, I have topics that are sensitive. I'm just looking. And right now, while I look, we're going to enjoy Okay, let me show you here what I have, which are a couple of websites I use to get information. So on the luteinizing hormones and the hormones, this is where I got the information on that from this website, from Science in the News. Taming the cycle, how does the pill work? Okay. So that's where I got that information from. I'm going to close that and you might get, yeah, there we go. And so I also have some birth control methods, which we'll take a look at. I also got some information from this website, which I think gave me information a lot on the risks and benefits. So not a lot of information, but there are a lot of links that I used, right? There are a lot of links there. That's from the Cleveland Clinic, you can see. All right, and so now, let me see here. That's our caffeine, so that's our next. So here are birth control methods that we have here. And you can see, you don't need to see my eyeballs. All dazed and confused. So different types of birth control. I thought that this was good information right here. Let's take a look at all the other questions. Which types of birth control help prevent sexually transmitted infections or disease? None. Which types of birth control can I get without a prescription? Male condoms, female condoms, sponges, spermicides. All right. Which type of birth control do I have to see my doctor to get? Oral contraceptives, the patch, the vaginal ring, diaphragms, and shots or injections. I use the sponge, and I think that the vaginal ring is a little more successful, but the sponge was not very successful. I mean, I'm not sure what holds it in place. Vaginal ring came after the sponge because nothing held it in place, right? Cervical cap, implantable rod inserted by a doctor in the office, IUDs, female sterilization, male sterilization, and a tubal implant. You can find out more information on each one of those where I'm not getting into all of those different procedures because we have a lot of these performance enhancing drugs and we're just actually going back to the pill. So we kind of got off track a little bit. So just, you can take a look at all that for, in the Food and Drug Administration. I don't know what you're doing with our birth controls, honest to gosh. I mean, why you would be having anything. And does that have anything with Roe v. Wade? I don't know. Food and Drug Administration, you got a lot of money to pour into Roe v. Wade now, don't you? And also then manipulate those laws in a way that allow you to do genetic engineering, gene splicing, and from what did I hear? Three parent embryos. Are you kidding me? You bunch of effing freaks, you. Which types of birth control do I have to see my doctor to get? Oh, we already said that. All right, so I got through all of these. Yes, I did. All right, so that's it. And there's some more information. But I wanted to take a look at this female and male sterilization, which is female tubal ligation or occlusion, or a male vasectomy. And it prevents, it's birth control that prevents pregnancy for the rest of your life. So it's permanent birth control. And in my process that I've been taking a look at this, I was reminded of, and we've talked about it here on the program, I was reminded of the fact that I had to sign a paper when I had my procedure for my reproductive rights because I was violated, right? So I'm just going to put it in those words because other words are very offensive to a lot of people, including me. I know, I can hear it. Call a spade a spade. I can hear you. I hear you. You know what I'm talking about then, right? You call a spade a spade. We'll see. I've called a spade. I've done it. You don't need to be constantly reminded. But after that sexual violation, I had a procedure done. And at that procedure, I had to sign that I may be inadvertently sterilized in the procedure. Now, I don't know how that happens, but what I do know is you're in a predicament at that point and you will sign it. And so this is, and I don't know what else, I wouldn't even read it because what is going to be on that paper that is going to make me not sign it? Nothing. And I remember my aunt saying, or somebody saying, you really need to read this because and it was probably after the fact, there is this sterilization. I think that the nurse probably said it to me. And then my aunt reminded me after the fact that that's the paper that I signed. What was I going to do at that point? And what kind of process would I go through to litigate a doctor who caused that to happen when I signed a paper? Despite the fact that it was under duress, what kind of litigation would I be able to afford to fight something about that signature, especially when it was made perfectly clear to me? But what was I going to do? What was I going to do? Now let's take a look at, so here you are in a pressurized situation where people can be clearly motivated to deny you reproductive rights because of their religious beliefs, right? And saving the world from your whatever behaviors. So there are people who are motivated to do that. There are people who are motivated to do genetic engineering on your eggs. They're motivated to steal your eggs. They are an enormously lucrative asset that the females have, clearly. And that's the reason why men have through the ages constantly deceived women about reproduction, reproductive rights, their children, and the genetic engineering that they've been doing on women's children. But to give you a much clearer picture of that, and so here, if you don't want to know about female genital mutilation, that's where I'm going. All right. So now is the time where you get to some sensitive information. So let's take a look at what this is, first of all. All right. So there are 4 different types, and this we find in Wikipedia. So 4 different, and I want to make sure it's all blown up right there for you. All right. So 4 different types of female genital mutilation. This is for you, Kate. This is for you. Okay, so normal. That is what a normal female genitalia looks like. So I actually am gonna blow it up, then we're all gonna see. So that's normal female genitalia, where it has a labia minor and a labia majora, however you say that. Major, labia minor, and labia major. So you can basically see that minor smaller on the inside, major larger on the outside, right? You've got your clitoris or clitoris, whatever. I say clitoris. And that is where females get their sexual sensation from. That is what brings a female to orgasm is the clitoris. And it is the only organ on male or female body that has one purpose only for pleasure, right? There are other things that have one purpose only, but a purpose for pleasure only. The penis has other purposes. Testicles have other purposes. Anus has other purposes. The clitoris has one purpose, and that is for female pleasure. And so that really needs to be sort of impressed upon you if you believe in an ultimate creator. What does that say? The urethra opening, so that's where we urinate. Females urinate. The vagina, so that's for penetration. And you can see the posterior, so that's your buttocks there, right there. All right? Now, moving along to B. So that's A is normal. And the picture B here is type 1 female genital mutilation. All right? So what they do is, you could say it's prepuce removal only, or prepuce removal and partial or total removal of the clitoris. All right, so what is that? That's what they call it, the hood. So if you're taking a look there on the left over the clitoris, you can't see the clitoris. What's pulled back in that picture there is the hood of the clitoris. It's pulled back. So what are they basically removing in type 1? They're removing the hood that is being pulled, that can be pulled back to expose the clitoris. So the clitoris is not exposed, rubbing on your jeans all the time or whatever, right? It has a hood on it. But if they remove the hood, what you end up having is an exposed clitoris. And that probably, again, isn't the best thing, you know? So what do? They sew it closed. Sometimes leaving the clitoris there, sometimes removing the clitoris. So removing the head, and at times removing the clitoris, which would be both type 1. Seems to me those are very different. Seems to me removing the head or prepuce and removing the prepuce, and the clitoris, either in part or total, those are two very, very different things. I'm not sure if I mind you taking and removing, although I hate to say it in that manner, the hood, right? But I can at least for, aesthetic purposes get it. Although again, there's no protection. And who's doing this? What are the scientists? And that's the whole thing. Again, this is science. This is medical science. And I've got another loaded piece of information for you too, after we're filled up with this enough. Type 2 is the removal of the clitoris for sure, plus part of or all of the labia minora. Now, I was thinking that in female genital mutilation that you could still basically stimulate the clitoris even if it's sewn up, if the clitoris exists there. But where else would a woman get stimulation from if the clitoris were removed? Could she ever have sexual stimulation? And then I was thinking, yes, you can get sexual stimulation from your labia, but just in case you get any sexual stimulation from the inner labia, we will remove parts or all of it. Ensuring that you get no stimulation from that area either. So the lips of your vaginal area, and boy, wouldn't that look nice and smooth, right? Like you were, I don't know, tucked. Like you were tucked, right? I don't know. Sewn together, covering the urethra and vagina and leaving a small hole for urine and menstrual fluid. So that's what's left of your female organs right there. A tiny hole so you can pee out of that hole, and out of that same hole, you would also have your period out of that same hole. Left her both of, which means, of course, that your pee had to be streaming through that same hole, right? So the urethra's covered up under there somewhere, because you could still pee. But imagine what that does to the cleanliness of that area. And yeah, I just am thinking about something that my son said, which makes me think that this is so much more prevalent than any of us ever thought. And so that brings me to my next website, which is from Penn Medicine. University of Pennsylvania, where they do the studies in positive psychology. They also do female genital mutilation, cutting, reconstructive surgery. And this is so interesting to me as well, that they're using the terminology cutting right there. So when women say that they are cutting, is this a euphemism for female genital mutilation? We see the crowns are euphemisms for sex trade, right? So another meaning, right? That's really isn't obvious. Clearly, cutting, the obvious meaning is this: I would be cutting to feel something if somebody did this to me. And I apologize for actually not sobbing as I'm talking about this. I apologize for not sobbing. The only way for me not to do that is to not think about what I'm saying right now. I cannot think about this. I am utterly confused. I'm confused by all this. First of all, there's only 30 countries where this procedure is legal. Now, I understand that there are cultural and religious beliefs surrounding this, but when you are completely taking away the reproductive rights of a woman and the sexuality of women under the guise of religion, when I'm sorry, when you can't even have a woman have a bare head or hair, you can't even have that. Where is the moral degradation then? Tell me, where is the moral degradation? Is it in these females that have lost their sexuality? That's where the moral degradation is? And the fact that University of Pennsylvania, Penn Medicine has it right on their website. I have words for it, but they just would be insightful online here. They would be insightful, and I don't want to incite people. What is the matter with you? What is in your head? What is the matter in there that would allow this in the United States of America, especially under this completely non-democratic facade that we have here, right? Where fascists come from? Facade. It's a big effing facade is what it all is. This democracy is a facade. If we have this here, we don't care about people. We care about exporting war, importing sex, and nothing to worry about because it's part of the Asian culture, primarily Asian Muslim culture. Why? 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 Is that really part of their culture, or where did it come from? Because we know Japanese culture was infiltrated for hundreds of years from their original roots of their, Eastern medicinal spiritual practices, right? Far removed. And in my Bookless classroom, I haven't gotten to world history. I'm not sure. I mean, I will get to it. Of course, I'll get to it, but I'm not sure when, because I've just been learning so much. But probably in World War I, which means probably pretty soon. We're talking about the economic structure of this undemocratic society and how it got to be so undemocratic. And the long and short of it is they were playing a monopoly game where they were the bankers, and literally they were the bankers. It wasn't common money of the people. They were taking money from the people and giving and then doing whatever they wanted. We don't have to finish the railroad. We don't care if the railroad's finished. We told you the railroad would benefit you, not us. Thanks for all your stock in the railroad. Thanks for all your genes. Thanks for signing away your eggs. Thanks for allowing me to take a few of those while I was there, if not all of them, under my evangelical sword. I mean, the only levity here is YAWP. Why all white people? That's the only levity here. So, they are talking about female genital mutilation. Don't mistake it for female genital mutilation / reconstructive surgery. This is female genital mutilation. And who knows when you go in there for vaginal reconstruction? Well, first of all, what I do know is they are taking away your labia, which is some of your sensuality. How sensual are you going to feel when they've taken away feelings of sensuality? And then, oh, by the way, how difficult actually would it be to not only, orgasm, but enjoy anything sexual despite them not manipulating your hormones? So your hormones are still generating sexual desire with this kind of equipment. What do you suppose that does for a guy? Is that where the term tight pussy comes from? Is that what they do when they sew women up? They tighten up your pussy a little bit? Is that what they do? Does that get you off? You don't have to look at any of the meat and potatoes there. You don't have to have any of the saucy sauce over there or the secret sauce. You just get what you want. I don't have to pee and I'm not menstruating. Cool. I'll take that hole. I'll take hole type 3, please. You don't think they effing order that? This is Dr. Annette Feravich leaving you with this picture. So thanks for joining me here on day 129 in the classroom. Oh, can't do that. That's the biggest I'll be able to get right there. There we go. Wait, I can make it a little bigger. There we go. Nice pictures. I told you, sensitive information. Thanks, Penn Medicine, for all your great research. All this great research and all the great money that went into this great research. And I'd like to also thank, all right, I'm not going to say it. I am going to look it up right now though, and then I'll say it. Because with such a high population of Arab people and Middle Eastern people and Muslim population, I can't imagine Henry Ford wouldn't do the same thing, but I don't know. Well, there we go. Look at that. But so this is how I do my thing. Nargawala, 44, of Northville, is not accused of performing any genital mutilation procedures at the hospital, but rather is facing charges for allegedly cutting the genitals of 2 Minnesota girls at a Livonia clinic in February. Her firing comes 15 days after her arrest and 1 day after her indictment on multiple charges in U.S. District Court. So she's been doing this a while. And what's the Livonia clinic? What's the Livonia clinic? That's a Michigan clinic. Why are they confusing things? Who cares where those girls came from? They came from out of state because they knew that they could get genital mutilation performed there. Who brought them there from Minnesota? I mean, you know, it's so irresponsible not to ask some very obvious questions. Nagarwala, who earned her medical degree, all right, so it's a woman, in 1998 from Johns Hopkins University and started a residency at Henry Ford a year later, was arrested April 12th. And of course, they're taking down women, not men, right? Yeah, this has nothing to do with the men. Of course it doesn't. Following a federal investigation involving cell phone records, surveillance video, text messages, and medical records. Oh, sounds like a setup to me, since none of those are trustworthy where I'm concerned. She is due in court today at 1 p.m. to be arraigned on several charges, including conspiracy, genital mutilation, transporting a minor with the intent to engage in sexual conduct, and lying to a federal agent. Oh, who was the sexual conduct for? Who is that for? Sounds like maybe somebody important in the Arab community. If convicted of the most serious charge, transportation of a minor, it's got to be she. There we go. She could get up to life in prison. The removal of membrane using a scraper and gave it to the parents for burial as part of a religious custom. That sounds, scraping is an abortion technique. Sounds like a young girl wanted to come in for an abortion, and it was the understanding that it was actually an abortion, but they didn't want to have that on the records, and they could religiously call it female genital mutilation. And they probably even just fudged all of that information right there. She was probably performing abortions, and that's what they did to her. That'd be my guess. Nagarwala is a member of a small Indian Muslim sect known as the Dawoodi Bohra, which was involved in a prosecution in Australia last year, which ended with 3 people going to prison, including a religious leader. How was she involved in that? Sounds like she was maybe she was testifying for the defense or for the prosecution. She could have been. Nargawala is charged alongside another doctor and his wife, Dr. Fakhruddin Attar, 53, and his wife, Farida Attar, 50. According to the indictment, Fattar let Nargawala use his clinic for the genital cutting procedures in February and helped facilitate the trip for the Minnesota girls and their mothers. He is charged with the same crimes as Nargawala. His wife is accused of holding the girls' hands during the procedure and instructing at least one member of her community to lie if anyone asks questions. All right, well, there you have it. Okay, so a little more information on who else is doing female genital mutilation. And Henry Ford, who has a stellar reputation as a hospital, but I'm not sure the name. The Ford family has a stellar reputation regarding humanity. But I don't know. I mean, I've seen people's reputation, like mine, ruined for a whole bunch of lies. So anyway, Dr. Annette Feravich, thanks for joining me here in the classroom. I'll be back in about an hour for our DIY. What are we doing on DIY? You know how I get so involved in these. And then what happens? Then I forget what I'm talking about anyplace else. So involved. So involved. Oh, it's this one. Is there evil? I worked a lot on that. The other night. This morning I worked on this class, but yesterday I worked on Is There Evil? I wrote that idea down. Can't remember what I'm presenting though. It was 2 days ago. I had a lot of work between now and then, including 3 classes. Hello! The stress and pressure. Crazy. Dr. Annette Feravich, thanks so much for joining me here in the classroom.